Feels like just yesterday. Before we look at the numbers, I just want, that was only 30 days ago that we saw the number of cases, the number of people coming into hospitals, the injections turned out to be correct, excuse me, because they were all believing the path of the virus spread. And reverse the spread, and that's what the closed down procedures did. That's what the mass trajectory to the downward trajectory. That shift in the trajectory, reduced by about 100, would have passed away. So all this inconvenience, all this turmoil, for what? To keep 100,000 people out of hospitals. That's for what? And not just for the retrospective, but for the prospective. Our past actions change. I will tell you the number of people sick tomorrow. So every day we get up, every day everyone says, oh, my number of hospitalizations dropping. And that is all good news. And that is a credit to the community and the social conscience. Or will the number actually wind up? Right now, we're at about 1,000 new cases per day. Is flat. Is plateauing at about 900, 1,000 cases. 3-4 than where we were, for sure. But 1,000 new cases every day is still a very high infection rate. It's still a burden on the hospital system. So we now are getting infected, and let's get more targeted in our response, right? We're fighting this state, the virus is reducing. Let's get more refined, more targeted. And I'm going to be speaking with the hospitals this afternoon. If you look at the past few days where the cases have been coming from, this is a 3-day, what they call rolling average, 17% Kings, 12% Bronx, 11% Queens, but then a snapshot of where the cases are coming from, but we need more specific information to have a specific battle plan, and possibly getting infected at work. Where do they work? How do they commute? Is it home? What's their sex? What's their age? What's their previous health status? What are the demographics? 289, lower than it has been, but still tragic and terrible. And March 18th, we said that we were going to close schools all across the state, K-12, and delivery services, child care options for essential workers. That is actually worked out well, not perfectly. We had to do it in a rush, but there are lessons that we can learn here. Job stepping up to do this. It was a hardship on everyone. But we made the best of the situation. Colleges and universities will also have the protective measures to put in place. You have 700 public school districts, 4,800 schools, and the education system are obviously critically important. We must protect our children, to come up with a plan to reopen schools. With all those new protocols, how do you operate a school in a way that would keep our children and students and educators safe. So we're going to have the schools remain closed by the end of this month. Again, nobody can predict what the situation is going to be by the end of this month. But in the meantime, meal programs will continue. The child care services for essential workers will continue. And then we learned we're going to be asking businesses to come up with plans that safeguard workers when they reopen. We need schools to come up with, we need to discuss, and we need to pay attention to this COVID crisis. People who are put in this situation immediately with no notice. This is a chronic problem. If you're feeling these issues, you're not alone. Situation, and it happens on a lot of levels. Three out of four say that their sleep has been confined situation, or you're in an apartment in a confined. Situation, you can't get out. It's difficult for emotional, and people should make the call. And get the help if they need the help. We also see March is when this started, 15%. April, 30%. That is a frightening. Your identity, you don't have to say where you live, but people who need help should reach out. There is no line workers. I mean, just think about what the frontline workers are going through. Think about what the healthcare affected. Are they bringing that infection home? So this is a terribly stressful, difficult time, especially is even nicer. So we have a special emotional support hotline which means the mental health services will be free for frontline workers, and they'll be at no cost. That's gone. There is no cost to get mental health services. So just said, when life knocks you on your rear, learn, grow up. And get back up. Was it A.J. Parkinson? It was not A.J. Parkinson. It was me. But when life knocks you on your rear, learn. And grow. And we will collectively learn and grow. We're going to learn pandemics and that possibility. But you know what? Until it happens, people don't really get it. Two people the dangers of a situation without people act responsibly. How do you do that? In a short period of time. What do you do about public transportation? You learn the whole day, and we try to make the best of a bad situation. You try to find that silver lining through the dark clouds. All of us try to do it in our this impacts your life dramatically. But personally, if you have more time with you now, then I will probably spend with you in the rest of my adult life. I said, wow, what is my baby? But you know what? That's probably right. You know, she's .22, she's going to go off, do whatever she does, and then you see her at holidays for a few hours here. These are, with all The bizarreness, I haven't been able to see my mother in 2 months, but we stay socially distanced, but we stay spiritually connected. New Yorkers have complied with these rules, as annoying as they are. Masks, 6 feet, this. That's out of, I wear a mask to protect you. For. And I believe that's where we are. Because we are New York tough.
Possibly sooner, and we're hearing that New York City, their teachers are looking at remote learning.
We have to decide on summer school. That decision will be made by the end of May. There is no decision on, this is going to be a real exercise, you know. We're talking about how manufacturing companies socially distance, how construction companies socially distance. How does a school do this? How many more buses do you need to socially distance on a bus? You know, there's a whole, how about a cafeteria?
They're going to want to run around and be together. In a school setting.
Well, look, that is a very good question, Karen, and that's what we, you know, talking to classrooms, what you need in a building, right? But then there's the other question of K to 12, and then how do I get students, in my opinion, a drop in the, or
I mean, how are they going to manage all this? They would, you know, need more classrooms. They don't even have the money for that.
well, that's right.
Now.
Depending on what Washington does. And they're doing remote learning, you know, the fiscal.
This week again, in terms of businesses?
May 15th is the decision on pause.
So you But will you announce it prior to that or
Well,
performance during this crisis?
tried my best.
On the regional reopening,
We're aware of what New Jersey's doing, what Connecticut's doing. We're trying to coordinate with those states. I've said from day one, knowing what they do is helpful. And then at the appropriate time, we'll make those decisions. The decisions, health issues, you have domestic violence issues, you have a lot going on, so you do want a relief valve, right? City and violation of social. Distancing. So that's what we're trying to work through for the summer and reduced the rate of hospitalization by about 100,000 and saved thousands.
Storage containers. Is there going to be an investigation into the Isabella geriatric center, and is there a way that there can be more investigation?
Specifically, individual problem areas that we've seen in nursing homes. So that will certainly be part of the Attorney General and the Department of Health investigation.
Will it be an investigation into deaths? Saying are in hospitals, but they're